Hello, dental online trainers. Dr. Dennis Hartlieb here with you again with another mini tip. I'm really excited to share with you one of the tools that I use in my practice that really make one of the more challenging things in dentistry and cosmetic dentistry much easier. I've always said that contour is king. And when we do our hands-on programs, we do a lot of work on contouring. Well, if contour is king, then I think that color is queen. And what I want to share with you today is a tool that I use that I think is going to make it much easier for you in practice. An instrument or a tool that I've been using in my practice, which I think you're going to find super valuable, is what's called the Rite-Light PRO from Addent. Now, many of you know Addent from the composite syringe that I use and from the composite warmer, but this is something that's super cool and I want to share with you how I use this in practice. Now, one of the challenges that we have when we are taking color for teeth, either for direct or indirect restorations, is the environmental color that we have in our operatories. Now, in my operatories, for instance, I have very large windows, and depending on the sunlight that is coming in through the window and the time of day, that is going to affect my perceived color of the teeth that I'm working on. So these environmental color issues are very difficult then for us to be able to find the proper color for shade matching. So this Rite-Lite PRO is super valuable for when we're trying to pick out the shade for the teeth that we need for either direct or indirect restorations. So what the Rite-Lite PRO does for us, it allows us to look at the teeth color with different lighting environments. So I'll show you when you click on the gray button on the top, it's going to give us first, this is sort of like a bright daylight. This might be like daylight at noon where it's a high Kelvin temperature, maybe 5,500 degrees, maybe a little higher. When we look at our tooth model, using this bright light, it allows us to be able to start looking. Now, what's nice with this Rite-Lite PRO is that I can actually dim the bright light. And you might see a little strobing effect from our filming. Now, if I push the white button again, you're going to see that it changes to sort of a warm white, a lower Kelvin temperature, maybe somewhere around 2,500 to 3,500. And when we look at this warmer light, which patients may have in their house, for instance, and we can change the intensity of that warm light from being brighter to a little less bright, and then to the dimmest setting. And then what's really nice is that with this light, if we push the gray button again, it'll combine the two. So we have both the daylight bright and we have that warm light for sort of a mixture to give us sort of a in-between mid-shade, a sort of a cooler white. And again, we can change the brightness of that between the three. So this allows us to be able to make more color appropriate choices when we're using our shade tabs like this. So in this case where I'm using some classic Vita shade guides, the A1, A2, I can look at it through the bright light. I can change to my warm white, my warm daylight. And then I can change the intensity of that. And then I can switch to the combination of the two, the warm daylight mixed with the bright daylight, or the warm white with the bright daylight. And that will help me get a better sense of should I be at an A1 or an A2, or is it a combination? So using this Rite-Lite PRO allows me to eliminate the environmental light that I have in the operatory, so that I can get a clearer sense and a more accurate sense of the light, of the color of the tooth, the shade of the tooth that I'm trying to match either with my direct restorations or with my ceramist. What's also super cool is they have these pink tabs that we can use for the background, which would be a little bit, maybe a little more accurate than if we're using the back of the mouth. And so again, if we go through and we have our shade tabs using this pink background, and I look through my light and we can look at the daylight, changing to the warm white, and then switch into the combination of the daylight with the warm light. So that's another way to help look at that contrast between the teeth and then sort of take out that back of the mouth area and using that pink, which is also nice when we're working with that soft tissue if you're looking at the cervical area of the tooth. There are two more features to the Rite-Lite PRO that I think are super valuable. The next one is that they actually have a cross-polarizing filter. So those of you who are using like polarized, like I do when I do my digital dental photography, to help my lab technician be able to take out the reflection that we get from the light off the surface of the tooth, to be able to look at surface texture, to be looking at craze lines, to look at color at a little bit different without that reflection. It's great because this Rite-Lite PRO also has a cross-polarizing filter. This filter just snaps right on in front of the light. So with the filter, it's going to require more light to come through. So I have to use the Rite-Lite PRO with the highest light setting, so then I can evaluate the teeth and the teeth color with the highest lighting coming through that filter. So these Rite-Lite, the cross-polarizing filters with the Rite-Lite PRO gives me the same information as if I am taking photographs and using my cross-polarizing filter or my polarize on my camera. I find these filters super helpful if I'm going to be doing opaquing and I'm looking to see, do I need to add more opaquer or can I see that transition between the tooth and the composite? So just as a little information on how I use it in clinical practice. The last feature on this Rite-Lite PRO that I think is super cool is that it has a black light element to this that we can look for fluorescence. So fluorescence is an interesting quality that's found in natural teeth. Fluorescence sort of gives a certain vitality to teeth that we sometimes are missing with some of our restorative materials. We'll hear about people who go to, say, a nightclub or go clubbing where there's black light and they'll have one tooth or they'll have several teeth that are cosmetically restored and there's not enough fluorescence or an absence of fluorescence in the restoration, and the tooth will look black when they're smiling or when they're laughing relative to the other teeth because there's no fluorescence or not enough fluorescence in the restorative material. So that's very important when we're using our composites and we're using our porcelains, is to understand how does that fluorescence relate to natural teeth and their fluorescence. In fact, the composite material that I most commonly use, cosmetic materials, their dentin materials have a higher fluorescence than their enamel materials, just like what we see in nature. So I'll show you how this works using this black light, and that is simply by pushing the purple button on the side. And it'll look like this as we look at it from the camera, and as we go over top of the tooth, then we'll see how we can, in this case, how because there is no fluorescence in this acrylic, it just looks dark. But if we were working with a natural tooth, we would be able to see brightness coming out because of the natural quality of teeth and the fluorescence quality that they have. Here's a natural tooth that I have, and then now you can see with the fluorescence on it, you can see how it becomes bright, especially compared to the side teeth where I have these plastic teeth that do not fluoresce. Okay, dental online trainers, that's it for this mini tip. Again, with the Rite-Lite PRO from Addent. If you're interested in this, just click the link and that'll bring you right to Addent's website. Again, I think it's just a great tool to use to help a complicated thing like picking the right color a little less complicated and a little more predictable. That's it for now. Great seeing you. Yours for better dentistry. I'm Dr. Dennis Hartlieb.